Hi guys, welcome back to the Bearded Chokra. I'm back at the Hair and Shape Clinic in Malad and I'm with Dr. Umang Kothari. Thank you so much for joining.
Thank you.
So, you were there in the first video itself.
That's
those who don't know you, just please introduce yourself.
So I'm Dr. Umang Kothari. I'm plastic surgeon and I am co-founder and director of the Hair and Shape Clinic, which is there in Malad. And along with that, I perform my surgeries in some of the nursing homes. I'm a visiting consultant at Copper Kirane Reliance, which is in Navi Mumbai, and I'm proud to be the part of the Bearded Chokra Experts Stay Pucho series.
Thank you so much. Thank you. So the reason why we are sitting over here again is that the first 3 episodes of #Experts Stay Pucho have done well. A lot of people have given good response to the entire series, and there was a lot of engagement with my audience.
Because it had a very good content, I would say.
Yeah. Correct. So now the thing is, we've put out, the basic causes and all of hair loss. We've put out PRP. We've put out hair transplant. The major thing that I've been asked by a lot of my audience is the cost and the fluctuations in the cost all over India, all over the world as well.
I understand, because there's a basic question even which we deal on a day-to-day basis.
Correct.
Yep.
So the main thing that I was asked is that suppose I'm getting this done, maybe say another state of India, there's a complete different price range. If I come to Mumbai, there's a complete different price range. If I go to somewhere like Turkey, where this is like a medical tourism, over there it's very cheap for the international people, but a lot of people are going there as well.
That's right.
So I just want to know कि ये जो पूरा price discrepancy है या जो range है, why is this happening? What are the factors involved in this?
So Abhijit, what I have understood with my experience, if you go to a typical corporate hospitals, you see they are twin sharing, they are single bed, there's a super deluxe, and the package varies from very minimal to 3.5 times of that.
Correct.
Now, hair transplant is a very much safe procedure. That means the complication rate in hair transplant is there, but is very minimal as compared to any other procedure. So people are taking risk of delivering the same services in a compromised condition, so that they can give in a cheaper rate to the required patient. So that's why it's a very...
Since there is not a lot of scope for damage to be done in the procedure, there are scopes for some compromises which a lot of people are doing.
That's right. So the price range varies even in India from 35,000, 40,000 to 8 lakhs, 9 lakhs. I have seen some patient coming to me. They have spent 8 lakhs 5 years ago to some clinic, and they are coming for the maintenance to this clinic. So imagine the whole spectrum. If I am quoting some amount, being a plastic surgeon with a dermatologist sitting in front of me, with another trained hair transplant surgeon with me, and the people will bargain with me, why so much, where there are different clinics which are giving me the same transplant with 10 PRP free, with 2 serum free, plus this medication free in a cheaper rate. So I always say, wherever you feel you are satisfied, go. Talk to the doctors, see for the credentials of the doctor, and get it operated there, wherever you feel comfortable. Being a surgeon, what we always say, you are suffering from baldness, we can treat this baldness. Suppose you suffer from baldness again, we'll treat it again. If I fracture my hand, I have a treatment for that fracture, but does that give me the guarantee that I'm going to fracture my hand again? No. Right. But it's very difficult to digest because people are spending so much. They want some long-term, short results. I'll again explain you the costing of hair transplant. So, suppose there's a trained staff, then definitely his or her salary is far more than the very juvenile staff coming out of any industry or just a 12th pass staff. If there's a trained doctor doing the surgery, of course, his surgical fees is more.
Absolutely.
If something is going to happen inside the theater, I should have all the equipments to manage that complication. So I have my investment in that aspect. to keep the operation theatre sterile so that you don't or patient doesn't get any infection. Even that has its maintenance cost.
Absolutely.
To keep my patient comfortable, I have to have a very much ergonomic chair on which there is no pain, even he is lying for the long term, even that has its cost. So everything is dependent.
Right.
Everything is dependent.
And I've been to this clinic. आप लोग ने वो hair transplant वाले video में भी देखा होगा. The OT over here, it's very sophisticated. It has everything that would be required in an operational procedure. And I think whatever you guys have seen from that, maybe the punches, the staff, everything. It's pretty much top notch over here. So sir, we've discussed, the factors that are involved in the costing.
Still, there has been in past incidences that we have done some hair transplant in 10 rupees per graft, which is bare minimum. We were doing 4 patients in a month. There was some scrutiny which was going on that suppose is a student who is suffering from hair loss and he has not started earning yet, or there is a poor guy with a limited salary budget, but he is not getting married because of this. So now it is very much thin line to differentiate whether it's an aesthetic procedure or a functional procedure. For the one who is suffering from it with a depression, it's a functional procedure.
Got it.
He is not doing it to look beautiful or to look handsome. He is doing it because he is suffering from it.
Right.
So then, being a doctor, if we cannot help those people, then I think it's not good. So we try to help those people.
And I don't think you guys would see this in maybe say a hospital or a corporate clinic, because
difficult to see.
They have a set price. It's like masala dosa is for this price and this price only. You're not getting it for cheaper because of your financial status. I totally understand, but I think that is really, really good in a private clinic like this, that you are able to judge a person's ability and cater to that specifically.
It's necessary. Yeah.
And so just talking about the cost, as you said, you've done it at as less as 10 rupees. Are you continuing that?
Not really, but yeah, if someone is coming to us with the demand, we scrutinize it.
What could someone expect to be the minimum rate per graft and the maximum rate per graft?
It's again a different. If it's a plastic surgery owned clinic, or if there is a plastic surgeon who has some extra knowledge about aesthetic of the face.
So for example, your clinic.
My clinic. The package may start from 55,000.
Okay.
Yeah, and it may go up to 1,60,000, 1,80,000.
Okay, so that would be depending on the grafts.
Depending on the grafts, depending on the package with which they opt, with the PRPs, the medications, included, not included, all the post-op visits included, not included. They want a different kind of doctor like plastic surgeon or a dermatologist or a normal hair transplant surgeon doctor to be seated or to be done, their case to be done by him or her, not to be done. These are all multiple factors. If it is only a chain of clinic, the package can start from 25,000 rupees.
Okay.
If it is again done by a dermatologist, the package can start from 30,000-40,000 rupees, as minimum as 30,000-40,000 rupees, and it can go up to 1 lakh, 5 lakh, 6 lakhs, depending on the other facilities.
Okay.
Or the doctor's experience. There are certain doctors, they do not operate below certain amount of money.
Obviously, that comes with the amount of time that doctor has also put into the industry.
That's right, and I say it's more like an architect job. If I'm hiring an architect for my interior design or my house, this thing, I don't expect him to put a brick and cement for me. What I want from him is a good planning.
Right.
The people who are going to execute it, they may be different.
Correct.
But the planning, that matters.
Absolutely.
Or continuous bird's eye watch on 15 people. That is what is important.
Right. And as far as you said, like 50k to 1.6. So is that the same? This rate was for FUE or FUT?
So no, FUT is more expensive. So
okay,
again,
so what would be the difference if you could just,
maybe 30,000-40,000 rupees, because FUT requires an operation theatre involvement or surgeon's involvement, some threads to stitch when we remove the strip out. So the basic difference between FUE and FUT, that FUE is a berry picking. Suppose there is an area of 20 by 20 square centimeter. I just berry pick 1, 1, 1, 1, 1, 1, 1. And that graft, berry pick graft are been transplanted in the front. So that in the back, you don't see any obvious scarring. It is distributed, well distributed in the back side. While in FUT, there's a small strip of hair that's been excised.
Right.
And then stitched back again the remaining scalp. This strip, each and every hair follicle, we take it out and we implant in the front.
Okay.
So eventually, it is not scattered scarring, it is a thin line scarring. With development of new practices, we are doing something called trichophytic closure. So even through the scar, the new hair comes. So even the scar is not that obvious.
Okay.
Yeah. So initially it used to be like the scar में से बाल नहीं आएंगे, scar दिखेगा करके. But then now we close in such a manner that the hair actually comes through the scar. So the visibility of the scar is on the lesser side now.
Okay, so if someone was to get an FUT procedure done, it would be around 30 to 40,000
more expensive, of course. Okay, there's a minimum to minimum 30-40,000 rupees.
Okay.
Anything FUT 80,000 and above. 80,000 or 1 lakh, that's it.
Okay.
Yeah.
And what about long hair FUE? Does that have its own set of prices?
Definitely. We don't do it long hair because we are not promoter of the long hair FUE. Suppose there's a patient comes to me that I don't want to shave my head. What is the option? I say nothing. You have to shave your head. That's it. Okay, but there is something called long hair FUE. But what we have seen that even after transplanting the long hair FUE, the stem falls off. So it looks really good for initial 25-30 days maybe, but when the stem falls off, you are back to the square one as per the non-long hair FUE.
Got it. So I don't think there's any use of getting it done unless and until it's like something you need for a very short time.
Nature is beautiful. Absolutely. Nature per se is very much beautiful. There may be some cases in which the falling never occurred. The follicle was so strong that the shedding never occurred. So people are now propagating about the long hair FUE. Those who are doing it or those who have invented it, there must be some science behind it.
Absolutely. So sir, thank you so much. I think this was a very enriching talk that we had because I don't think anyone talks about the cost so openly and what goes behind the cost. But I really appreciate you doing that. And I hope कि आप लोग also you make the most out of this. The free consultation जो मैंने पिछले वीडियो में आपको बोली थी, that is still going on till the 31st of December.
Yep.
That is on only for the people who call over here and take a prior appointment with the clinic. तो आप इधर call करिए and once you know you fixed your appointment, then you come here, you get a free consultation. Apart from that, after the consultation, if you go ahead for any procedure, be it a hair transplant, a PRP or any of the other cosmetic procedures that are there over here, you guys are going to get a flat 10% off. आपको सिर्फ मेरा वीडियो उन्हें दिखाना है that you come through the Bearded Chokra channel and you guys can make the most out of this. So
sure.
So thank you so much.
Thank you, Abhijit. Thank you.